this, and I'll put it into speaker view, and you should be ready to go, Courtney. Take it away.
Awesome. All right, you guys, thank you again so much for joining me today. JB is actually at my high school coaches. They did a parade for him back in my high school in Middleton, Wisconsin. He's going on hospice. So if you guys could send some extra love to the George family. He was a Wisconsin swimming great and swam for UW in the 90s and was a big time coach through the club circuit for many years before he went to high school. So appreciative of all the coaches because you've impacted people's lives more than you know. And so say a big prayer for them if you think about that. Here to talk about today is some posterior chain and leg strengthening that's specific to swimmers. This is not as injury heavy as the shoulder. As we know, the shoulder is the most common site of injury, but there are still things that we can do to really build power and strength to maximize our efficiency in the water. One of the areas that we do see a lot of pain though is with breaststrokers' knees, okay? Because of the angle and torque that we have to create from the hip and then the angle that puts the knee at, it just puts us in a compromised position. And so in the program that I'm gonna send, I'll probably send it to JB just because he's the one that I have the email and he sends everything out. I have the PDF ready to go for you guys on this. But I do have at the very bottom breaststroke specific strengthening exercises and some mobility that's specific to breaststrokers only. In breaststroke, most of the power is driven from a lateral movement or what we call in the frontal plane. So our body's going out to the side. Freestyle, backstroke, and butterfly, that's all done in the sagittal plane, meaning we're moving into flexion and extension at all the joints. And so we have to take in special consideration when strengthening with breaststrokers because their force is derived from a whole different plane of motion. And so if you start to get into those higher level strengthening and dryland programming for your breaststrokes, it should look unique and different than the other strokes that you're training for, just because the demands placed on the body are so much different. And with breaststroke, it's especially important that we're addressing glute strengthening. Again, as that's going to control the rotational component of the femurs or the legs, but it's also going to allow us to drive a better whip kick through the leg. And I'm just reading Bob the note. Looks like you can chat to me only. Okay, so if you do have questions, just send them to Bob and Bob will throw them into the chat to me. So with this, just like the other PDF that I've built, it's going to be a 2-day program, okay, with some mobility and stretching to add in, and then also the breaststroke piece. And I'll talk to you about exercises you can take out from the regular circuit and substitute with the breaststroke specific ones. One of the big things that I see when I'm treating breaststrokers especially is that they have really poor hip internal rotation mobility, and we're going to talk about that later on, but also that they have underdeveloped gluteus medius muscles. And this is actually something I see with most of my swimmers is they have pretty strong glute max, just like the rest of society. We have decently strong glute max, but the small rotator muscles that come from the base of our sacrum and actually come in a lateral direction that give our pelvis stability, we're actually pretty weak because we don't train those muscles very often. And so I'm going to give you ways to train those specifically to work on that. The other thing that's super important is that your swimmers understand the components of lumbar hyperextension. No, I'm not going to address that today because I wanted to keep this more geared towards pelvis and below. But making sure that when they're doing this, they're not hyperextending because that can put them at a risk. So basically tell them engage your core or squeeze your butt when doing things. And that's going to give you that more stronger stacked streamline position, keeping them in a better brace neutral spine. Okay, so that's just kind of a standard. We don't ever want to be overextending with any of these exercises. So across the board, when you're doing these with your swimmers, tell your swimmers, hey, you don't need to be way back here when doing these, okay? So what I'm gonna start with is let me move things over. I'm just gonna move my computer here. So the first exercise that we're starting with, a sheet of paper here, is called the spider stretch. And again, this is just a warm-up exercise just to get things moving and going. So I like the spider stretch, and I'm getting all the way down. Let me move my computer. So my back knee is down on the ground, and I'm bringing my other hand in, kind of like a Spider-Man, okay? And what this is doing is it's putting one of my hips into full extension and my other hip into full flexion. So I'm getting through the full range of motion of the hip, which is needed when coming into a flip turn and then coming out, because we go into extreme flexion and then quickly into extension. So this is a great way to just grease the grooves essentially and get through that full range. And then you can switch sides and get the other one here, and you can rock back and forth, okay? Pretty basic, but this one's a really great stretch and also a really great thing for competition day as far as a dynamic warm up. What I love to have swimmers do is, you know, if you're at the U of M and up on the top there where all the parents sit, there's that long stretch of carpet, and have them creep and crawl doing those spider stretches to really make it an active stretch as opposed to just a passive stretch. So that's another important thing to be thinking about with this mobility, okay? The other stretch that's gonna be done on the floor is gonna be working on that same position, but now my back leg is up, okay? And I'm gonna take my hand that's closest to my knee and work into that trunk rotation. So this is carrying over from the shoulder session that we talked about. We're working on that thoracic rotation. Now we're combining that with a little bit of lower extremity control. Okay, so I'm here, and then I'm working on rotating from my trunk, not just whipping my arm back. Okay, so rotate, and then you can go and do the same thing on the other side, rotating. Okay, just facilitating that whole body roll, and now we're integrating the hips and the legs into this. Now, the other thing that we're going to integrate from the last session is we worked on that swimmers have this hunched back thoracic position. So I'm going to give them a drill to work on that opening position into that overhead squat. Okay. So what you can do is I have taken this is a curtain rod, but you can use a PVC pipe, a dowel, like a broom handle, and we're going to do an overhead squat. Now, this is a pretty technical movement, but because we're not doing it with weight, it shouldn't be that big of a deal. But what it is going to point out to you is if your shoulders are super flexed forward, they're going to have a really forward trunk angle. And you'll see that, and I'll demonstrate here that. But that means they can work on a lot of that thoracic extension to help get into a better streamline position. Okay. So again, what this movement's going to look like, far enough back. So I have my bell overhead, or my rod overhead, and then I'm just coming in to my overhead squat position, but I'm not way up here, okay? So you can see my trunk is still staying relatively upright. I'm not way back here when I'm squatting. And if you see that with your athletes, if that bar or their PVC pipe is way behind them, they don't have the mobility in their T-spine. And that's a way to tease that out and tell them, hey, you need to be working on this because we're really limited there. The more that we can get that to move and generate more of the force, the better, okay? So that's a great mobility screen, but it's also a great warm up just to work on, because when we get down out of our turn, right, we actually need to be in that same position to get out of the wall. And so if we can strengthen that on land, that's going to carry over into that explosive getting out of the turn position, okay? So that's your warm-up piece. Then we're going to move into circuit 1. Again, these exercises that we're putting in are geared towards your freestyle backstroke butterflyers. Not that breaststrokers can't do these, but I have some other ones that may be a better idea to switch out, okay? So the first one that we're going to do is called a Bulgarian split squat on a ball, okay? So I'm going to take my ball and I'm putting my back leg, this is hard to see. I can set that up here. Okay, so I have my back leg on the ball, okay? And then I'm basically doing an inline lunge. Let me get myself, there we go, set up, okay? So I'm doing that inline lunge. My knee is not diving over my toes, okay? My knee is staying tracking out. It's okay if my knee goes over my toes a little bit. Actually, we need that to occur, but my knee is not diving in, okay? Now, the reason I chose a stability ball is because it places more demand on the leg itself to do the work, okay? If your athlete is really struggling with this and they don't have good coordination or balance, bump them down to a stable surface, like an ottoman or a chair. But for your higher level athletes that need that challenge, this is hard, okay? But again, the biggest thing that I want to see is that that knee isn't diving in, okay? If the knee's diving in and you've given them repeated cues, that means their glute muscles are weak because our glute muscles control this motion of the knee, okay? So if they can't figure that out, then they really need to work on some glute strengthening, or one of the exercises that we have in here, they need to do that even more than what's prescribed on here, okay? So that's your Bulgarian split squat on the Bosu ball. The next exercise is going to be a squat jump to a streamline position. Now I love this one because it forces your athlete to think about that good control, but also power either off the blocks or off the wall. Okay, and you can tailor this to what your athlete needs more if you're looking more for starch or for turn work. But one thing I like to do with my athletes, and I'll show you the squat jump to a streamline, if you guys can see, okay? So I'm coming down into my full squat, and then I'm landing it into my streamline and landing into my squat, okay? This is a really great way to get their heart rate up and work on some plyometric training and that reactionary training. You can also make this more start specific. So if your athlete is more of a track start, okay, and you want to do more starts as opposed to turns, you can start down here and have them jump into that streamline, okay? Or you can have them do their more traditional front start out to the side, right? And then quickly get into that streamline position. So this one can be focused on turns or starts, but this one is done for time. And you can tell I'm a little out of breath trying to do this and talk. So their heart rate should get up, okay? What I've put in there is about a 30-second time domain to work on that fast power output, thinking like a 50 freestyle, okay? They should be able to go balls out for 30 seconds and then take a break, okay? But with that being said, this is a tough one. So you're gonna wanna give them a break of like 30 seconds to a minute to make sure that when they do that second set, they can still go fast and rapid. So either a 1-to-1 work-rest ratio or 1-to-2 work-rest ratio, okay? But that one should be hard, and they should be fighting for that really good streamline every time they get into there, along with either their good squat mechanics or their good track start mechanics, okay? Looking at exploding through their heels and driving through the legs to get up and seeing how high they can get up with each jump, okay? The last one we're gonna focus on is an RDL, a single leg RDL, and this is to strengthen the posterior chain. Posterior chain consists of the hamstrings, the glutes, and the low back muscles. Super important to strengthen this because swimmers are predominantly quad strong, okay? Just like most of us, we are really good at using our quads, but we don't always know how to use our posterior chain. And when we're swimming, if we're not getting good drive from the back of our leg to pull us up and then our quads to pull us down, we're lacking some of that power that we could be utilizing to really get a good drive, especially off the walls, okay? So the posterior chain, you're gonna wanna tell your athletes, I want you to feel this in your hamstrings and glutes. And this is more of a push pattern as opposed to a pull, okay? So with this single leg RDL, I've taken it to a single leg because that forces the swimmer to work on stability through the midline and also control their pelvis. So if they're really uncoordinated, they may have to do this through a smaller range of motion. If they're pretty high level and they're strong, then you want to have them work on this as far as they can. But if your athlete is tipping over all over the place, it's okay to have them hold on to something with their other hand just to give them that sense of stability. but it's still gonna force them to really work on that single leg control. So with an RDL, what we're looking for, and that stands for Romanian deadlift. What that means is it's a straight leg deadlift, not a bent knee deadlift like your traditional barbell deadlift or hex bar deadlift. This is gonna put a lot more force through the hamstring as opposed to the glute max. Not that it makes a difference, we're still getting glute max recruited, but it's a little bit more hamstring dominant. So that's why I chose this one, it's just a little bit more effective. So with this one, before I even show you with the weights, I'm gonna show you a side view, okay? So what I'm doing, and I'm gonna be standing on my left leg, okay? And I'm keeping my legs straight. I have just a tiny bend in my knee so that I'm not hyperextended, okay? And then what I'm doing is I'm coming into a capital letter T. My balance is off today. So I'm coming into this capital letter T. If both of my hips were headlights, they're pointed straight down. I'm not rotating open, okay? So this capital letter T, and then coming back down. To generate that force, I'm pressing through my heel on that standing leg, okay? And then to stand back up, I'm squeezing my butt to bring me back to neutral. Now, most of the time, your athletes will need some sort of weight to feel this. Chuck was wondering if there will be a PDF. Yes, there will be a PDF. So a lot of the times I like to use a kettlebell. One, it gives you a little bit of counterbalance, so it helps with the balance component, but it also allows you to feel that hamstring just a little bit better. And this is safe for your younger athletes that maybe haven't been doing a ton of weightlifting, but like 15 to 20 pounds is totally reasonable and not anything too extreme to be placing on a growth plate. So it's okay to add a little bit of weight to this one. But again, I'm gonna put my kettlebell on the opposite hand that my leg is driving through. Okay, so I'm here, capital letter T, push through my heel, squeeze my butt. Okay. And again, you're gonna wanna do this on both sides. This one is done slow and controlled, whereas like the jump squats are more of a high-paced, fast movement. So we're just trying to get a little bit more control on this one, because you could whip through this one really fast, and then you're just moving around the hip joint and not actually engaging the posterior chain. So really slow on this one. And I put that in there that it should be a 3 count down, 3 count up to really focus on the engagement of those muscles. Okay, so that's circuit 1. Circuit 2 is going to be looking at a lot of the same movement patterns, just different ways to do it. Okay. The first one that we're going to do is called the Goblet Squat. And I've chosen that one because it places the external weight in front of us, which makes you engage your core more. And anytime that we can simultaneously integrate core and either trunk and shoulder, Lee, I'll get to your question in just a second. Trunk or shoulder or trunk and pelvis, the better, as opposed to just doing a single movement. So we want integrated strengthening with this. Should swimmers focus on the hip hinge with the RDL? Yes, that's a great, great point. So that hip hinge that she's talking about is and this is a great drill to do with your swimmers if they don't understand the hip hinge, is putting that same pipe that you used for the overhead squat, and I have it at my neck, T-spine, and then low back, okay? And then I'm having them hinge or bow forward while keeping those 3 points of contact so that they understand how their butt has to shift back or hinge back. Leah, does that answer, or does that give you any ideas on how to add that in with swimmers? Yeah, so a lot of times, and I have to do this with my patients, no matter if they're swimmer, soccer player, whatever, they don't know how to do a hip hinge properly. And so that PVC drill or pipe or whatever you have access to really facilitates that movement pattern, and then they can add the weight in or move to that single leg. So great question. Okay, so circuit 2, back to the goblet squat. Again, integrating core and pelvis control. So with the goblet squat, we're holding our weight right in front of our chest or on our sternum, and we're keeping this as close to our body as we can. So I have it quite literally right up against my chest. Okay. So I'm here, and then I'm squatting down and driving back up, okay? All while making sure that my knees aren't collapsing in, okay? My trunk stays upright. I shouldn't be bowing forward, okay? Nice and tall. So that is your goblet squat, okay? One way, if you're working with more sprinters, you could do a 2 count down, explode on the way up, okay? If you're working at more of an endurance athlete, you're 500 to milers, make it a 3 count down, 3 count up. So you can change the demands based on their stroke specificity or their distance, okay? But you can really make this explosive or slow and controlled depending upon what your athlete needs. The next movement is also going to be working on the explosiveness of getting out of the wall or off the blocks, okay? And this is going to be a thruster. This movement sucks no matter if you're in shape or not, okay? But it's meant to be that way. It's meant to make you work really hard for it. And so your athletes probably don't need a ton of weight for this. But it's a great way to get you into that full flexion pattern, fully drive extension pattern. And again, we need to be able to cycle through that really quickly to get into a turn fast and then off the wall fast. So with the thruster, what we're doing, I'm going to show you with 1 kettlebell because that's all I have at home. Ideally, you'd have two dumbbells, but you could also use a med ball and do a med ball thruster. You could use 1 dumbbell if that's all I have. And I'll show you those different options here after I show you the movement pattern, okay? So I'm taking my kettlebell, okay? I'm gonna move one thing out of the way here so that you guys can see. Okay, so I have my weight up in front of me, okay? I'm gonna come down into my squat and drive with my legs to get my arms up overhead. So squat, press, okay? The way that I get my arm up is through that quick explosive hip drive to get myself back up. If they don't have, you know, a kettlebell or they only have 1 weight, you can hold it close in front, squat, press, squat, press, okay? Same thing if they have a ball, a med ball, would be done right out in front. I don't have a ball here, squat, press, okay? And that one will get your heart rate up pretty darn quick as well, okay? The last one, let me get my band here, is going to be a banded lateral walk to work on that glute med muscle, okay? And again, glute med is the muscle that comes from our sacrum and attaches out to our side, and it's going to control the rotational component of our leg. It's also going to give our pelvis stability so that when we are doing things on land, our pelvis doesn't drop. But in the water, what that relates to is your breaststroker's power, okay? But it also is going to relate to your swimmers on land, making sure that their knees are in good alignment. So with this band, I'm actually going to place this around my forefoot. A lot of times what we see people doing is putting it around their knees or ankles, but we know with EMG activity that we get the most glute med recruitment when the band is at our feet. Okay? So I'm going to set my band up around my feet. And then what I'm doing is I'm just coming into a partial squat ever so slightly. My weight is back a little bit and my knees are driving out. From here, I am taking 1-inch steps to the side, okay? I'm not standing up and coming in and I'm not sliding my band. I'm staying in that squat position and keeping tension on to really engage those glute muscles, okay? So that's another great one. If they don't have a band at home, if they have an old pair of goggles, they can use that if they're okay with maybe breaking those. But that's going to be your side step with the band, okay? Those are all really great exercises. And Denise, we'll get to your question in just a second here. Those are all really great exercises for freestylers, backstrokers, butterflyers, okay? The glute, the side step with the band is going to be super important for those athletes that when you see them doing the squats and the lunges, if their knee is collapsing in, they need to be doing that regularly. Denise, let's go ahead and hear your question.
I guess I have a little bit of a technical problem here. Trying to unmute her. Denise, can you unmute yourself? Let's do this. Go ahead, Denise, try it now. Actually, we ended up losing her. That's not good.
If she joins back in, we'll give her the floor. But
yeah.
I'm going to continue on with breaststrokers, okay, and how to do a little bit more integration of specific breaststroke training. So, though again, we need to work in more of a lateral plane, or what we call the frontal plane, to strengthen some of those muscles that are specific to the breaststroke whip kick. And so to do that, we're going to add in a lateral side step, and then also a lateral lunge, and then some mobility drills to really work on that hip internal and external rotation. You can take out the Bulgarian split squat and then also the goblet squat in exchange for these exercises. Okay, so these would be their counterparts working on the same muscle groups, but more specific to breaststroke. Okay, so with a lateral lunge, what I'm looking for is I'm going to set up a really wide stance, okay? Kind of like a split triangle here. And then I'm going to work on sticking my butt back and driving in to that leg that I'm leaning towards, okay? What you can't see is that my knee is not going way over my toes, okay? So one way that I do this with my athletes at the clinic is I put them up against the wall, and then their wall is their drop, because what will happen is they'll do this and they'll jut their hips way out and their knee will torque in, okay? So to really prevent that or teach them the motor pattern, I'll do it against the wall, and that just acts as a natural block for them to really get into that good pattern, okay? So again, lateral lunge, sitting the weight back into my heel, okay? You can obviously would do that on the other side, okay? The other one that's more breaststroke specific is doing a modified pistol off of a
Looks like we got Courtney frozen here for a moment. And Denise, you're back. I tried to unmute you. It seems to be working okay now, but we'll see if we get Courtney back.
Okay. Yeah, my internet was flaky. I plugged in, so hopefully this is better.
Okay. Okay. I'm still showing her as being connected, but there's no video and and no sound.
Oh, there she is. She's back.
We back?
You're back too.
Yeah, I can hear you.
Okay. Can you guys see me?
We can now.
Okay. Did I just cut out at the very end, or did you guys miss the lateral step?
You were just going to get up on the black thing on the floor.
I was just going to get on the black thing. Okay. So the lateral step, okay. My leg that's on here is my driving leg, and I'm bringing that heel down and driving up nice and slow, okay. What I'm making sure of is that leg that's on the box, my knee isn't collapsing in. So it's staying nice and aligned, hip, knee, ankle, and I'm driving that heel down, okay. Again, that's more of those glute specific muscles that are needed for breaststroke, okay.
Okay, we've got Denise back now. So go ahead, Denise. I think you can unmute yourself and go and ask your questions. Oh boy, we're gonna do this again. Try it again, Denise.
Okay, am I on? Okay, can you
There
hear
we
me,
go.
Courtney? Okay, so I have a question. It's a little bit of the opposite. I have a breaststroker who is really good at the external rotation, right? Like, so she walks with an external rotation, all of that stuff. She can't do squats. She won't do squats or any forward lunges. She can do side lunges. She can do Cossack squats to some degree. She can do step back lunges. But anything that's a regular squat or a forward lunge, right? Like, she's so externally rotated that like that starts to hurt her knees. Flutter kick will hurt her knees. Anything that requires an or adduction starts to hurt her knees. So I need to figure out, whereas most of your other swimmers have problems that you discussed the first half of this,
Yeah.
I need to kind of figure out how to get her strong enough because she's so limited to all the movements, whether they're strength or stability oriented or whether we're doing a cardio piece. She can't do a thruster because she can only go down about 2 inches, right?
Yeah, so a couple pieces that I would be looking at in clinic are, does she have the adequate dorsiflexion in her ankle? Because that's going to be a huge limiter on how deep we can go in the squat. And maybe it's not even coming from the hip, even though she has a hip mobility arc change, meaning she's more into external rotation. But with swimming, our feet are always in plantar flexion, right? So we're really limited in bringing our feet into dorsiflexion, and that's gonna limit your squat pretty substantially. So one thing I would try having her do is put some plates. So I would use 5 or 10 pound plates or some hooks under her heels. Okay, I can't quite see that. And that's gonna take out the motion restriction that she may be limited in and allow her to squat with a little bit more upright posture. Okay, that may be one thing that I'm looking at. The other thing is, are we getting some sort of pinching or impingement at the hip because she's so externally rotated and the femur is coming forward? So with that, what that would tell me is if we're getting a pinch in the front and that's causing some pain into the knee, then we need to do a ton of glute strengthening and some of the hip mobility that I'm going to go over here. But Denise, that brings up a really good point. It's kind of hard to pinpoint without talking. So one thing, and just so that you guys know, Minnesota is a direct access state, meaning if you guys have swimmers that are having pain and you don't know what to do, I am available virtually to see patients and help them out if you can't problem solve with a few things, because sometimes it's tough to know where exactly that pain can be coming from without a full eval and workup on what's going on with her. So if you guys ever have any swimmers that you're like, they need PT, but I want them to see a PT that understands what we're doing, I'm available to help you guys out with that piece. And so that's a really cool thing about the state of Minnesota is that even though I'm in Rochester, I can treat, anywhere within the state boundary. So, so try those couple things, Denise, first, and have her try some of this mobility. And if that's not adequate and it's not changing her pain, send her my way, and we'll get her taken care of. Okay. So let's talk a little bit about this hip mobility piece. That's also super important for breaststrokers. And there was a question, let me go back. I've got to find my cursor, here we go. How tall is that thing I was standing on? I was on 2 45-pound plates, so I would say that's probably about 10 to 12 inches. Is that the black thing you were talking about, Terry, or were you asking about these guys here? Because these are about 1 inch. But this, you can even do that on a chair, okay? If your athletes don't have that, they may just not go the full depth, okay? So they maybe just do something like that, okay, or off the bleachers. So with breaststrokers, right, we need this, what we call total arc of motion. Meaning we need really good hip internal rotation and external rotation to be able to go through that full range of motion. And so a couple ways to work on this is I'm going to set myself up into what we call a shin box. And these are my favorite. Okay. So the first thing that I'm going to do is I'm setting myself up in a 90-90 position. Okay. What I'm going to do from here is I'm just going to come up onto my knees and then come back down without using my hands. And what that's making me work on is more of this hip internal on one side, hip external on the other. Okay. And then I would obviously switch and do the other side. Okay. Again, this is really important for breaststrokers, not nearly as important for your other swimmers. Okay. The other one that I'll do, okay, is to really work on what we call windshield wipering or greasing the grooves essentially of the hip joints, is coming into this 90-90 and then rocking into the other direction without the use of the hands, so that I'm using those hip joints and I'm really moving through those, okay? So those are some other really great mobility drills just for the hips to really grease the joint for your breaststrokers who are gonna do that motion over and over and over. So that should be, if anything, part of their warm-up routine if you know you have a stroke day. Like it's a, a test out set or today's a stroke day. They should be doing 3 to 4 minutes of this mobility piece before they get into the water. So those are the 2 different circuits there. What questions do you guys have for me on those at all? Bob, you're muted. I can't hear you.
Sorry about that. I'll unmute the entire group. So if you want to identify yourself before you ask your question, we'll give you the floor.
This is Leah. Do you recommend for kind of glute med stuff like clamshells and leg raises like that?
Oh yeah.
Okay.
Yep. Yeah, there's tons of glute strengthening exercises. I just chose the ones that I tend to go to first in the clinic, but there's a ton of other ones out there that are going to accomplish the same thing. So yeah, absolutely.
Okay.
So one thing that I would consider when building your dry land programs is making sure that you have an endurance or a strength piece, and then also a plyometric explosive component, because you need both to occur from the legs. And so making sure that you're training that in ways that help your swimmers, keep their legs and their dolphin kick going for a mile, but also help them explode off the blocks and explode off the walls. Any other questions or injuries that you guys see commonly that you have questions about?
Louise, did you have a question?
So often breaststrokers in particular have knee issues. And if you have a breaststroker who is having knee issues, do you recommend them backing off from breaststroke and doing some other type of movement in the water, or should they just emphasize more of the strengthening exercises and try to go with it?
Yeah, that's a great question. Typically, the first thing I'll have them do is go to a dolphin breaststroke, so that they at least still get part of the stroke pattern in the arms, but we're taking away that whip portion of the knee that puts them into what we call valgus moment at the knee, which causes a lot of that strain on the middle portion of the knee, the MCL, the meniscus. And sometimes that can be enough to calm things down if we just switch to that. But then I'm also highlighting like, hey, you need to do a ton of glute strengthening over the next couple weeks, and then make sure you're doing that long term. Just like with the shoulder, as it's super important to be doing some sort of prehab. breaststrokers especially need to be doing some sort of glute prehab to make sure that those glute muscles, because essentially to them, the glute is to breaststroke as the rotator cuff is to freestyle backstroke and butterfly. Okay, so that's kind of the linchpin there in breaststroke, and so they need to be doing some form of glute strengthening all the time to make sure that that doesn't occur. But to answer your question, yeah, I wouldn't pull them from practice because they can still do a lot of other things, but I would take out breaststroke kick for a short period of time if they're doing kick sets and switch more to a dolphin breast. Yeah, they're going to be a little bit faster, but they can at least still get some of the same stimulus from the workout by doing the same stroke.
Thanks.
Mm-hmm.
How often do you see in breaststrokers specifically, do you see that it's like predominantly the glutes, or do you ever see that it's more weakness in, you know, the quad kind of connection into the knees and things like that? And what do I mean, do you ever see that? Is that a thing? And then if so, like what are some good things? I mean, I know kind of a modified pistol is good for strengthening those little muscles, but anything else? And I guess see that more, I think, in younger kids who aren't quite as developed, but.
Yeah, so it's typically going to occur from a motor recruitment pattern and usually not so much a weakness. Now, there is likely a weakness component or strength deficit, but they probably don't know how to adequately control their knee and femur in space. And so when they're doing that kick, they're coming even too far in, they're getting a huge whip from the tibia and fibula, as opposed to driving most of that motion with the hip. Does that make sense?
Yeah.
And that's it's part of a motor development thing. And so getting them on land and working on some of the mechanics so they can feel that. Usually it's not going to occur from a quad weakness. It could. That's a slim, it's less on the likelihood of a differential diagnosis, but it's likely more of a motor recruitment and that they don't know how to adequately move through the pattern. And then when they're getting in, they're just whipping too far and they're just creating this torque with the tibia and fibula as opposed to moving with their whole leg, if that makes sense.
Okay.
Yeah, so that's typically what I see. Or they're really good at hip external rotation, but they have really limited hip internal rotation, which is what they need. And because they're so limited, then the other joints down the chain have to take the brunt of that force, and then that's the knee.
Okay.
And so doing some of that hip mobility, even at a young age for those athletes, is super critical.
Okay, that makes sense.
Any other questions, you guys? So I'll leave you guys with a couple things here, and I'm going to let JB, I'll give him all the information to send out to you guys. But again, I'm available for telehealth visits if you think your athletes are kind of beyond your knowledge of what to do at that point, or they already have an injury and it's just lingering and not turning the corner. A little bit more individualized and focused strengthening may be necessary than what I've given you in just the packet, because that's a little bit more general to more of a mass team as opposed to what the individual may need. And they can also do like a free 15-minute video analysis where they call and I can say, oh, you know what, that really sounds like an injury. Or, hey, it sounds like if you addressed one or two of these things, you may do just fine and you maybe don't even need PT. So that's always an option, okay? The other thing that I have available to the swimmers is I'm doing swimming performance packages. And so if they want to build an individualized program for each, you know, for whatever their goals are, I'm offering that to swimmers across the state to really build programs to their specific needs. So if that's ever something that your team is interested in, feel free to give that out. And I'm going to give both of those links to JB because it is important that you're strengthening with the sport in mind and not just doing generalized strengthening just to build strength. just because the demands of the sport are so unique, and swimmers don't always have the best understanding of how to move outside of the water. So you have to pick smart exercises so that they don't get injured trying to get stronger. So I will send all that out to JB along with the PDF of the exercises that I've put together today for you guys. But as always, I'm here to be a resource. So if you guys have specific questions, you're like, man, I just have an athlete and I'm not quite sure how to proceed. What do I do in the next couple days here? Shoot me an email, because this is my passion. This is what I could talk to you guys about this for hours, but I'll spare you that time. And so don't ever hesitate to reach out. I want to be a resource and available to you guys for any questions that you may need, especially, you know, knowing that it is important to have that swimming background to keep your athletes in the water and give you ideas to modify that still allow them to keep training.
Fantastic. If there's no other questions, Courtney, thank you so much. This was wonderful.
Yeah, absolutely.
Amazing advice, and very much tailored to our needs here in the sport. Coaches, unless there's anything else, thanks so much for signing on today. And like Courtney said, you'll be hearing from JB next as far as the recording is concerned in PDF and next time you gather. If there's nothing else, take care. Thank you again, Courtney, for everything, and hope the rest of your day is fantastic.
Thank you.
Take
See
care,
you guys
buddy.
later.
Thank
Courtney.
you.
Thanks, Bob.
Thank you.
Bet.